Hello and welcome. I'm Dr. Liana Lianov, and welcome to this Lifestyle Medicine podcast series on behalf of the RCSI, University of Medicine and Health Sciences. And today our topic is nutrition, and I'm delighted to have with us Dr. Seema Sarin. She's board certified in internal medicine and lifestyle medicine. She's a fellow of the American College of Lifestyle Medicine, a medical director at Evelance Health, and she supports her patients in the community to live a healthier life, which is what we all want and we're here to talk about. So welcome, Seema.
Oh, thank you so much. Thank you so much for having me. It's a pleasure to be here today.
Yes, well, this is such an important topic, what we eat. And we were just talking a little bit a while ago about how it's a little bit controversial what different experts say about what we should eat. But the growing consensus around the lifestyle medicine community is around this whole food, plant-based eating. So tell us more about that.
Yes, absolutely. Food and nutrition is so important, and it has a significant impact on chronic disease prevention, reversal, and treatment. So, nutrition is a really important topic, and I'm glad we're discussing it today. In fact, some studies cite that nutrition can be the leading cause of chronic diseases like cardiovascular disease, diabetes, stroke, etc., the top causes of disease and certain cancers by about 50 to 60%. And if you include lifestyle in that, it's about 80% that is the cause of these lifestyle changes that are not ideal, unfortunately. So when we think about nutrition and all the different diets out there, there's a lot of factors that go into it. You know, there's personal factors, cultural factors, even governmental and global factors. So when we're thinking about diet and nutrition and health, it's important to understand what exactly is the right diet. And that's something that is individualized for everyone's needs and culture and background. But generally speaking, if you look at the data, a whole food, plant based diet oftentimes is the best type of diet. In fact, there was a study done that was published in 2017 by The Lancet that looked at 195 countries from 1990 to 2017. And they did a systematic analysis of the global burden of disease. And they found that the parts of a diet that are more attributable to mortality have to do with a diet high in sodium, a diet low in whole grains, low in fruits, low in nuts and seeds, and low in vegetables. So it's important to, when you're looking at the ideal diet, to really make sure that you're doing that whole food, plant-based diet, which can include things like plenty of vegetables, mushrooms, fruits, legumes, whole grains, nuts, and seeds. And then avoiding things like sugary drinks, processed foods, processed meats, especially processed snacks, pastries, sugar, red meats, things like that.
Yeah. That all makes sense. Kind of in a nutshell, the closer the foods are that we eat to where they came from, their point of origination, and the less processed, the healthier they are. And that's a nice, easy message to remember because it can get quite complicated pretty quickly. So thank you for that. And
Yes.
a lot of our listeners may have heard about the blue zones. The blue zones are very popular. Those are areas around the world where they have high percentages of centenarians, people who live to be 100 and beyond. And they have some factors in common, including some healthy eating. To tell us what we know about the blue zones.
Sure, yes, and I think you did a great summary of what the blue zones are. It's that recipe that people and communities are adopting to live healthier, happier, longer lives. And a few of them, there are a few pillars that Dan Buettner, who started the Blue Zone studies, found in those communities. And part of it was diet. It's whole food, plant-based diet that includes more of a Mediterranean diet, everything in moderation. Some places had a little bit of cheese, alcohol, different meats, and fish especially would be that meat of choice, for example. But it also included a full lifestyle, very similar to the pillars of lifestyle medicine. So it's not only about eating healthy, it's about exercising regularly, finding your tribe, tribe, having the great social connections and positive relationships, finding ways to manage stress effectively, everything in moderation, making sure you're not doing any risky substance use and abuse, and appropriate restorative sleep. So those are the main tenets that you want to keep in mind when seeking kind of not only the healthy nutrition, but a healthy entire lifestyle as well.
Yes, and that's what this lifestyle medicine mini podcast series is all about, is we're talking about all those pillars and how they reinforce each other. And you really need the whole package for total well-being. And so that's well said. And in this segment, we're focusing on nutrition. So tell us a little more about what the science says is really going to help us be the healthiest and happiest in terms of our eating.
Yes, absolutely. You know, something that is to consider is something called food as medicine. If I don't know if you're familiar that with food as medicine, or our listeners are familiar with it, I'm sure you are. But food as medicine is the way it refers to a spectrum of services and health interventions that recognize and respond to that critical link between nutrition and chronic illness. And food as medicine is a way that we can adapt the proper nutrition to large communities and systems. So the food as medicine indicators of need is if you have a high level of food insecurity, lack of accessible and reliable transportation, and a high burden of diet-related chronic diseases. And that's where food as medicine interventions can be really effective. And something to think about when you're looking at kind of the food as medicine pyramid, you want to work on prevention to treatment, whether it's providing food and emergency food programs like SNAP and WIC versus nutritious food referrals, medically tailored meals, and the likes for our sickest population members. So when you're thinking about nutrition, it's not only on the individual level, it's within our families and communities, and creating that full system. So physicians have referrals to food banks and other places where we can get the proper resources, and also understand what it means to, how do you cook well, how do you eat well, how do you foster that community within your own family, for example, learning those kitchen skills and food habits, and what is your budget, what is your culture, because every culture has very nutritious, wonderful foods that we want to make sure that we tap into.
And every region has their own community resources. You mentioned SNAP and WIC, and keeping in mind our global audience, maybe give a little example of what those are. They probably have similar programs where there are.
Sure, yes. So SNAP and WIC. So that's SNAP is a supplemental nutrition assistance program. That's what SNAP stands for. And that helps low-income individuals and families by providing monthly benefits to purchase food. And that is done by our government in the US. There's WIC, which is a special program. It's a supplemental nutrition program for women, infants, and children. And that's what that WIC stands for. But it provides nutrition education, breastfeeding support, healthy foods, and referrals to healthcare and other community services for pregnant women, new mothers, infants, and children, as well as fathers and anybody else related to that unit that could use help.
Yeah, thank you. Thank you for that.
Yeah.
So we've touched on how food can help us to be healthy and some of the things to avoid. And of course, we know that there's the recommendations, and then there's real life. And real life, it makes challenges us to really stick with those tried and true health recommendations. And so practical tips about how to eat healthier are very important. So can you share some of those?
Yes, absolutely. The first thing is to think, to congratulate anybody who's looking to eat healthy. That's the first part of the health journey. You want to just to acknowledge that, because oftentimes we're stuck, something called the global world may not have this acronym, but we call the American diet the SAD diet, the standard American diet, unfortunately. And it is a hard thing to break out of, to understand kind of the importance of the whole food plant-based diet that you may not be able to pick up as easily on the way home from work, for example. But what really works for my patients and the communities I work with is first understanding, what your goals are as a person, your why. Why do you want to adapt healthy habits? The second piece is to break down your goals into SMART goals, which are specific, measurable, attainable, time sensitive, and realistic. So you want to really kind of think about not only like, oh, I need to eat healthy, but you really want to think about, okay, I'm going to increase my fruit intake by having 3 oranges slices and 4 pieces of broccoli, my fruit and vegetable intake, twice a week at lunch. And I will pack my lunch to ensure that happens for the next 2 weeks. And we'll see how that goes. So breaking it down, making it as specific as possible, knowing I have broccoli in the fridge, for example, making them accessible. There's a great book called Atomic Habits that I just picked up, which is a great way to kind of figure out how best to adapt these new changes, and maybe even connecting them with something you do every day. Like when you brush your teeth, you think about what kinds of fruits and vegetables you're going to incorporate in your diet every day.
Yeah, perfect. Absolutely. We need to plan ahead, and we need small, doable, tangible steps. So that really builds success. And then from the positive psychology perspective, as we achieve those small steps, celebrate and be proud for what we do achieve, and shift away from shame and guilt. And whatever we haven't achieved, that's okay. We'll set a new plan and keep moving forward, one tiny step at a time. So yes.
Exactly. And it's a true iterative process. So it's really about the journey, not necessarily the destination, and enjoying that journey along the way really is key.
Yes. I love that. So as we close this short segment on nutrition, any parting words, any last key message, key takeaway for our audience?
Sure. I think the key takeaway is congratulations. Thank you for joining us today. And congratulations on making this first step and listening to this podcast to understand a little bit more about nutrition and health. And I thank you.
Well, thank you for speaking with us, Dr. Seema Sarin, and thank you to our audience for listening to this Lifestyle Medicine mini podcast series, and we'll hope to see you on another segment soon. Take care, everybody. Bye-bye.